This shortage is another reason. It's actually a blessing in disguise because it brings out the importance of the community approach. You see, in the community approach, you are also mobilizing people to look after themselves. And this helps to keep the cost of healthcare down. So in that sense, that's why I'm saying it's a blessing in disguise. At the same time, we can use first-line healthcare providers like community health workers. Sometimes people say that it is second-class care. It is not second-class care. It is appropriate care for that first line. And you see, they can help us promote health, they can help us prevent disease, and they can provide first-line cure, like for diarrhea, like for malaria, which is killing our children. So, although there is a shortage, that shouldn't keep us from achieving UHC, because Ethiopia still has a shortage of doctors. Ethiopia still has a shortage of nurses, but they have enough health extension workers, and they have achieved universal health coverage. They were the only country in Africa to achieve MDG, Millennium Development Goals. And of course, Rwanda, your country, has also done well in reducing maternal mortality and child mortality because of the community approach. So although we have a shortage of the top professionals, I don't think we need to worry too much. We can concentrate on the community health workers and their supervisors, and once we get their supervisors in place and organized, we can achieve UHC. And we build on that, we shall then save money, because we shall, as you prevent disease, you become economically more productive. So we shall become richer. And we can then have as many doctors as we want, as many nurses as we want, because we shall be able to afford it.
All right. Now, talk to me about quality healthcare on the continent. Once we've managed to get enough professionals and community health workers like you mentioned, the next concern, I think, is going to be quality healthcare. Now, what should be done to ensure both go in tandem?
I think that as someone who has taught in medical school for many years, my approach was, and I think the approach can be helpful, if we can say, we must recognize that health is a right of every human being. Sometimes quality is affected by people looking down on others. If it is a minister, I should give them very good care. If it is a cleaner, I should not. But they are human beings, as according to the Bible, and I'm a Christian myself, they are all made in the image of God. So if we can begin by realizing that health is a human right, and at the bottom of the right to health is compassion. If you believe that people have a right and you are compassionate towards them, then you must do the best you can do. Because sometimes what reduces quality of care is just carelessness, not paying attention to what you are supposed to pay attention to. So I think that is the first level. The second level is, of course, to be properly trained. And the third level is to have the proper equipment and supplies to do your work. For instance, there are times when in our hospitals you don't have gloves, and you need to examine a woman who is going to have a birth. Now, you can't examine her without gloves, for reasons that your hands may be dirty, and also she might have HIV, and if you examine her without gloves, you might get it. So there are some things like that that will be critical, essential, that we must have. But they are not complicated things. They are simple things, which Africa can do, which Rwanda is doing in many cases.
All right. So you talked about proper training, proper equipment. I think both need financing. There's need for money to do that. And statistics indicate that Africa's government are spending quite a small percentage of their budget to health. So what should be done, in your opinion?
I think that our leaders need to realize that health is the foundation of development. One of the reasons Ethiopia paid so much attention to health is because they found that their farmers were sick. If a farmer is sick 100 days out of the year because of malaria, diarrhea, cholera, and whatnot, then they cannot produce. Even if they are working on the road as road builders, they cannot work. So health, even if they are in an office as an accountant, but they are sick, they cannot produce. Whatever you are, if you are a teacher, but you are sick half of the time, you cannot teach. So Ethiopia realized that health was the foundation of a productive nation. And this is what we must realize. Whether we have money or not, we must invest in health, because you must start somewhere. And if you invest in health, you will make everybody stronger, a healthy population, which can produce more.
Finally, as an academician, what do you think about Africa's education in terms of health? What should be done to actually make sure that graduates in the health, education are responsive to Africa's healthcare needs?
I think Africa medical schools have been trying to train their students from the point of view of Africa's needs. But unfortunately, actually, Africa's health needs have caught up with everybody's health needs. We have what we call a double burden of disease. We still have a very heavy load of infectious diseases, but we also are having non-communicable diseases. So we have both. So it means that what a student in America needs to know about non-communicable diseases, a student in Africa also needs to know. I think that the teachers are aware of this. What sometimes is lacking is the lack of sufficient financial resources to the medical schools to train people properly, and to schools of nursing and the schools of midwifery. And so I don't think Africa lacks the money in terms of, if you look at Africa money and you look at what is required, if you look at the money before it is divided, it is enough, but it is how we divide it. Now, some goes into very big cars for some people, some more goes into this, and we just need to cut our cake, our coat according to our cloth, so that if we make the commitment to improve health, and health is the bottom line. One of the former director generals of WHO used to say, his name was Dr. Mala, he used to say, health is not everything, but without health, you have nothing. It is true of the individual, and it is true of the nation. Health is not everything, but without health, you have nothing.